You are all in for a major treat. Susie has an incredible presentation planned for us. And for those of you who aren't familiar with the REAP office, it stands for Resource Entitlement and Advocacy Program. I'm thinking the A, trying to make sure what the A is, the advocacy program. Yes. And this is a program, and hopefully she'll explain a little bit more about it, but this is a program that is on Madison Avenue and about 97th Street. And it is free for all members of the Mount Sinai community. And it is an incredible program that's aimed at helping connect our patients with the resources that they're entitled to. If you get referred there, you would get assigned to a REAP counselor who would basically help you figure out and apply for your benefits. So it's an incredible resource. So again, she will make that information known to you, and I hope it's something you all choose to take advantage of if you think there's something that could be useful. Susie's presentation today is really comprehensive and quite amazing. And the goal of it is to teach you all, as we keep on using the double whammy cancer patients and COVID patients, COVID, living in the COVID era, what resources and benefits might be available to you during this kind of unprecedented time. And she's going to get very specific. She will also talk a little bit about COVID testing and vaccine access and that type of thing for those who are eligible, because I'm sure that is a question.
Well, how are you guys doing? Welcome, everyone. Welcome to 2021, although we're well into January. But I just wanted to provide you guys with some information regarding government benefits, entitlements, and benefits, and then also to highlight some of the waivers and extensions that has existed because of the COVID pandemic. So we're just going to take a look into some of those information, including the background with REAP. Rachel, if you can just scroll down.
Sure. And in terms of your introduction, would you like me to do the introduction, or do you want to just introduce yourself?
Yeah, I'll do that with this slide here. Okay, so my name is Susie Giffrod. I am a social worker at the Resource Entitlement Advocacy Program. We are a small but mighty bunch. We consist of 4 social workers, 6 care coordinators, 2 administrative assistants. If your patients are familiar with us, we're closely located to the main hospital. We are between 97th and 98th Street on Madison Avenue. At this point in time, due to the COVID pandemic, we're not seeing patients in person, but I am a social worker who assists our patients with entitlements and benefits. And whenever there's a situation where we need to step in, where a patient needs access to care, also with information that it would need in terms of the community. That includes cash assistance, food benefits, anything like that. And even if you're unsure of what the person may need, patients or otherwise, we will always look into the patient case to see what they may be eligible for. And so REAP is a program that started in 1989 with the purpose of educating patients with access to resources and access to healthcare, including individuals who reside in the East Harlem community. So it's not just limited to Mount Sinai patients. It's going to be for individuals who reside in the East Harlem location. Next slide. So in terms of what we offer, we mainly focus on a lot of insurance-related issues. So Medicaid is one of the ones that we highly focus on in terms of Medicaid through New York State of Health, which is the state who provides insurance for individuals. Some patients will Some patients will refer to it as Obamacare, Affordable Care Act. It's used interchangeably. We can certainly screen them for that insurance eligibility. For individuals who are over the age of 65 years old and receipts of Social Security disability, or if they have Medicare, they would go through the Human Resource Administration, which is essentially a program that helps them apply for Medicaid, but the criteria is a little bit different in terms of income and resources. We also assist with Child Health Plus, which is for children under the age of 19 years old who would like to be insured. And the premium is based off of the household size composition and as well as the income. Essential plan would be for someone who has a higher income threshold, who is eligible to apply for insurance through New York State of Health, as well as the qualified health plans. For those 3 categories or 4 categories, we do have a navigator in place who assists our patients with these insurance. They are available Monday, Thursday, and Friday. And what we do initially is screen them for these insurance. And then we will schedule a phone appointment because at this time we're not seeing anyone in person due to the pandemic. And we will be able to go over the plans that's generated for these patients and, premiums, deductibles, et cetera. If that applies to a patient, we will go over with them what that entails, including the provider and what they accept in terms of the plans. So we have a generalized list of plans accepted at Mount Sinai Hospital. So we will be able to inform the patient what plans are accepted at Mount Sinai. There may be a difference in terms of what the provider accepts. So we would have to contact the provider and let them know the plans are accepted for patients. Part D enrollment, Part D is in dog. This is going to be in terms of the Medicare prescription plans. So there is a list of insurances that's available to patients that we can go over. If the patient's already enrolled in a Medicare Advantage plan, meaning that their Medicare is combined, Part A is in boy, B is in boy, D is in dog, and if they are already enrolled in a Medicare Advantage plan, the open enrollment period for them to switch their plan is right now. So from January to the end of March, they'll be able to either switch their Medicare enrollment plan or go back to the original Medicare with a standalone Part D plan. So if there's any questions in terms of their provider no longer accepting their Medicare Advantage plan, or they would just like to switch because their out-of-pocket expenses for medications or to see a provider is high, we can certainly schedule an appointment to see what's offered to the patient. Medicare Savings Program. This is typically for people who have a lower income. This is going to be for someone who requires assistance with their Medicare Part B as in boy, in which they have to pay for this year, 2021, $148 per month to have out-of-pocket expenses for their outpatient visit. Most people, when they enroll in Medicare, they're going to have access to free Medicare Part A, which is the inpatient visit. So when they're admitted into the hospital, they'll have their coverage paid for by Medicare. But Part B is in boy, is for outpatient visits, and most people have to pay the premium, which is $148 per month on average for most patients, to be able to get access to care. If their income is lower enough, they'll be able to be eligible for the Medicare Savings Program, in which the state is paying for that $148 per month, so they will not be responsible. So that is something we can screen for. EPIC is also in a program that is provided by the state, If someone has a Medicare Advantage plan or a Part D prescription plan, and they're enrolled in Medicare, we can see if they're eligible for EPIC, which is the elderly pharmaceutical program that helps them with their out-of-pocket expenses, including deductibles and premiums. So definitely give us a call for that. SNAP is going to be food assistance, otherwise known as the food program. Other people refer to it as welfare, but it's related to grocery store runs and food assistance. So depending on the household size composition and the household income, we can determine if someone is eligible for SNAP benefits. Screen injury, one is for seniors. The other acronym is for someone who is considered disabled. Is going to be a program that essentially stops the rent amount in which the patient is paying. So for instance, if someone is residing in a location where their rent is $1,900 a month, and there's an annual increase from the landlord, the program will pay the difference. So they're going to be responsible for what they have been paying with the rent lease. And whenever it continues to increase annually, the program will pay the difference based off of you being a senior meaning over 62 years old, or if you're disabled, then that program can step in and assist with that. For the Mount Sinai financial assistance, we refer to it as charity care. These are for people who are considered uninsured or underinsured. Uninsured, you have no type of medical insurance. And so we would apply for this application based off your household size composition and your income. We would basically estimate how much you would be responsible for in terms of the medical bills. You wouldn't be responsible for the entire amount. It could be 5% of what you owe on the medical bills, or it can be as high as 80% depending on your income. So that's something we can certainly look into with the COVID pandemic. There's been some easements if you're experiencing financial hardship. So that's something we would certainly screen for and advocate for with the public. Sorry. Hello?
Hi, we can hear you, Susie.
Oh, sorry. Okay. So the public financial assistance program. With the public financial assistance program, we do have a number of patients who are considered undocumented, who are only eligible for the emergency assistance Medicaid. Emergency assistance Medicaid can only cover a certain amount of programs, including immediate emergent situations. It covers cancer, it covers dialysis. But if someone was looking into generally a primary care provider or a specialist, it may not cover that. So if someone were to apply for emergency Medicaid within Mount Sinai Hospital, they would automatically get charity care. And charity care would be applicable to patients who are seeking those services. So they're not responsible for the entire amount of the balance of the bill, but it would be a portion of the bill according to the household size and according to their income. So that is something that patients can certainly reach out to for family and friends who meet the category of being a Mount Sinai patient or within the East Harlem community. Next slide. So we do a lot of advocacy work, especially now with the COVID pandemic. There's been a number of waivers, easements, and special enrollment periods for many of the benefits. So one of the ones that we look into is Social Security benefits. If you're applying for Social Security income or Social Security disability, you were denied, which is not uncommon for people who apply for Social Security benefits, we can refer you to one of our contacts at New York Legal Assistance Group who assist our patients with appeals or who assist our patients with the application process. It does require a lot of handholding. So these individuals know what the Social Security Administration is looking out for and what they expect, including medical documentation that supports whatever disability the patient is applying for, so they know what to look for. Hospital bills. We mentioned charity care earlier. If you don't fit the category that I mentioned previously, we can always see if you're exception to the rule. So if you're underinsured or uninsured, or if you are insured, but perhaps your deductible is pretty high in terms of what your employment provides, we can always see if maybe you're exception to the rule. Particularly with the pandemic, we're going to check and see with the patient financial office to see if it's a possibility that, hey, you may be eligible for assistance with your medical bill. Complex benefits issues, there's always going to be a number of issues that comes up in terms of insurance. So if anything comes up in terms of, hey, we're not able to provide our deductible for this medical bill, we will look into organizations that may be able to assist with paying that or, a payment plan. So when in doubt, just reach out. That's essentially what we're going to do with patients. If we're not able to have the information on hand, we'll always try to see if there's some resources that's available for organizations outside of the community. Next slide. So New York Legal Assistance Group is a group of attorneys that provide pro bono services to our patients for a variety of reasons. Government benefits, so if you already is enrolled in Medicare or Medicaid, and for whatever reason, the benefits expired for any type of reasons, then we can always look into that and refer you to one of our attorneys to assist you with that. Insurance disputes, we've had a number of patients in which they had full insurance. However, their insurance company is refusing to pay services that should be covered under their policy. So we will refer that to New York Legal Assistance Group, and they will go ahead and do a lot of handling with the patients in terms of disputing what the medical office is essentially saying. With housing, with the COVID pandemic, there has been a number of eviction processes in which a lot of people have not been able to go to the housing court because of the COVID pandemic. However, we have seen a number of patients who've been threatened by their landlord to be evicted by X amount of dates. And with the COVID pandemic, there's been easements in terms of paying off the rental arrears as well as the housing court. So if a patient is being evicted by their landlord or threatened eviction, that is something certainly that should come to our office so we can follow someone higher up into our office. Immigration is also popular with our office. So if someone is undocumented, meaning that they have not entered the U.S. Legally, we can always see if they are eligible for some type of assistance with seeing if they're eligible for immigration consultation to adjust their immigration status in the U.S. Many people were a little bit concerned with the previous administration, and so we would not have a lot of phone calls from clients who are undocumented because they were concerned about applying for benefits for their children. And so we can always screen these patients for benefits, regardless if their children are U.S. citizens or not, but also refer them to the public charge immigration officers who are able to determine if they were to apply for specific benefits, if it would affect the parents, if they were going to apply for a green card or adjustment to immigration status through their children. So we do have a lot of referrals in terms of immigration. Debtor creditors issues, which is going to go back to patients who call us and say they can't afford the deductible, they can't afford the out-of-pocket expenses, and so we'll refer them to the New York Legal Assistance Group to see if there's a possibility of having that resolved. Workplace accommodation for those with disability and with advanced planning, which is going to include the wills, the healthcare proxy, and power of attorney, which is what the attorney at Mount Sinai would be able to assist with. Next slide. So some of the benefits that we're going to overview is essentially most of the benefits that we receive phone calls from patients. Medicare is one of the top ones. Medicare is a federal health program where an individual who's either entitled to it because of the work quarters that they have worked into or because of a disability. When we say entitled to Medicare, most of the time they have worked 10 years or more and reported their income to the Social Security Administration or through taxes, in which they would be eligible for Medicare. So that is typical of people who are over 65 years and older. So if you're 65 years and older, you've worked more than 10 years into the system and you reported it, you're usually going to be entitled to Medicare Part A, which is basically inpatient coverage. Inpatient meaning that once you're admitted into the hospital, it's going to cover that insurance. People who are under 65 years old with a disability, they may be eligible for Medicare as well. That includes Lou Gehrig's disease. If you're also a recipient of end-stage renal disease or a kidney transplant, then you may be able to have Medicare even beyond 65 years old. Unfortunately, there's not a slew of diagnoses that you may be eligible for in terms of Medicare, but it does limit itself to Lou Gehrig's disease, end-stage renal disease. And if you're a recipient of the Social Security disability income for more than 2 years, then you automatically become a recipient of Medicare. Next slide. So this is just an overall general view of what the Medicare plan covers. So Part A, as we mentioned, was the hospital insurance. So once you're admitted into a hospital, Part A, as an apple, is going to cover that type of insurance. Hospice is also covered under Part A, as well as home health care. But home health care is going to be limited. So you can get up to 90 days of coverage for home health care while you're in the community. If you need long-term care, we would need to look into a program such as Medicaid. But home health care will provide you skilled needs services, short-term, but it's not forever. So this is something we can screen patients for in terms of long-term care. For Part B as in boy, it's going to cover outpatient insurance. So that includes just seeing your primary care provider, lab results, rehab, medications, depending on if you have received a transplant or not. And with these two, Part A as in apple, Part B as in boy, most of the times we see patients are automatically eligible for Part A because they have succeeded reaching the 10 years or more eligibility to receive Part A. Most patients will be responsible for paying their Part B premium. I believe for the year of 2021, the average primary insurance is going to be $148 a month. So that's usually deducted from their income. If a patient has a lower enough income, then we can look into what's called the Medicare Savings Program, and that's where the state will come in and pay for the Part B as in boy insurance. So we can also screen for that to see if you may be eligible to have a state pay for your Part B premium. Next slide. So Part C is essentially the Medicare Advantage plan. It's combining Medicare Part A as in apple, Medicare Part B as in boy, and Medicare Part D as in dog, which is the prescription plan offered through a program. The biggest difference between Medicare Part C and just having Medicare Part A and B as in boy with a prescription plan is that it's managed through a program. So when you're applying for, let's say, United Healthcare, or I'm trying to think of the program, Aetna, and you want their plan to be facilitated by this one program, the biggest difference is going to be that your primary care provider has to accept that plan. If you're going to apply for Original Medicare with the standalone Part D plan, Original Medicare is going to be Part A and B, and also the standalone plan from the prescription, which is Part D as in dog. You're going to have a wider network of providers you're going to be able to see who accepts Medicare. A lot of people like Part C because they're able to get over-the-counter deductions. They're also able to get some dental and vision plans, but it depends on the patient and on what they prefer. So they can also consult with their primary care provider to see if that's the plan that they accept, or if they would like to switch back to Medicare Part A as in apple, B as in boy, and have a wider network of providers that are able to see to have their coverage covered by Medicare, excuse me. With Part D as in dog, prescription drug coverage, that's just specifically providing information on the prescription that is offered to patients. So if someone who has Original Medicare Part A and Part B, they are also going to enroll in the Part D prescription drug coverage. So they'll be able to have a wider network of providers that accept Medicare, but they'll also have to choose separately a prescription drug program that covers their medication, and that is something that we will have to screen for and look into in terms of enrollment. For the Part C and CAT, the Medicare Advantage plans, right now the open enrollment period is from January 1st to the end of March. So if a patient wanted to switch their plans in terms of now until the end of March, we'll be able to see what plans may be a little bit more affordable for patients and switch them to either another Medicare Advantage plan or to switch back to Original Medicare, which is Part A and Part B, with a standalone Part D prescription coverage plan. So that's something we can screen for patients to see if they may be eligible for that. Next slide. So the calls that we usually get from patients essentially is here. So we have a number of patients who call and say we only have Part A, which is going to be the insurance that covered inpatient insurance, but they don't have Part B. We have a number of people who opt out to enroll in Part B as in boy because it's going to cost them $148 a month. It may incur in a late enrollment penalty fee, depending on their household size composition and their income. So we can assist them with the enrollment process during the open enrollment period. As of now, patients can apply for Part B as in boy through January through March, and it will be effective July 2021. So in the interim, while they're trying to get insurance for outpatient visits, we can see if they're eligible for secondary insurance through Medicaid. So that is something that can be referred to us, and we will screen the patient and the family to see if they may be eligible. Another issue we have, I don't have Part D. Part D is in dog, which will essentially be the prescription program. We can see if a patient could be eligible to enroll now or in the future. So that's something that can be referred to us as well. Why is Medicare the primary payer? It depends on the patient's circumstances. If someone is working and they have Medicare, depending on the type of organization they're paying for, Medicare may be the primary or the secondary. Primary meaning that the insurance that's going to be billed is Medicare first, and whatever secondary insurance you have will be billed second. So it depends on a lot of factors. So we would have to look into the patient's case to make sure that Medicare may be the primary or not. How come I have all of these bills? Medicare covers 80% of the bills for most patients. So if there's 20% that is going to be left over, we can look into secondary insurance or other assistance that may be able to help with the out-of-pocket expenses. I can't afford my Part B premium. That refers back to the Medicare Savings Program based off your household size composition and the household size income. We may be able to detect if you would be eligible for the Medicare Savings Program in which the state is paying for those premiums. I'm in the wrong managed care plan and I cannot see my doctor. So whenever we're applying for insurance, we make sure that the programs or the managed care plan that patients are enrolling in is an insurance that's accepted by their providers. So we do have a list of what's widely accepted across Mount Sinai Hospital. So although we have this list, providers may accept more or less than what we have on that list. So it is best for the patient to contact their provider to make sure that the plans that they wish to enroll in would be a plan that's acceptable by that particular provider. I cannot get the home care that I need. So we do see this issue a lot with patients. With Medicare, it is short-term home care. So if you're admitted into the hospital, but you need long-term home care in the community, we would have to screen you for Medicaid. Medicare only provides up to 90 days of home care. However, it's not going to be a solution for long-term care. So we can screen you or your patients for long-term care. Next slide.
And I'm sorry, Susie, how would you like to handle questions? Do you want to hold them to the end and then I can kind of feed them to you, or should I note them as they come up?
Yeah, it can come up. I see one from Robin.
Mhm.
Is REAP available in states other than New York? Unfortunately, REAP is only available to individuals who reside in the New York area. If someone is residing outside of the state, we can certainly try to see if there's resources available, but primarily our program is focused for individuals who are residing in New York City. Okay. All right, so in terms of the COVID relief with Medicare, there's two different types of equitable relief that is available to individuals who should be in receipt of Medicare. The regular equitable relief is for individuals who, for whatever reason, has not been able to enroll in Medicare because the information they receive from the Social Security Administration or some type of employee was something that they have not been able to. So we can always see if a patient is eligible to enroll in Medicare because of the information they received from a federal agent. With the COVID equitable relief, this is for individuals for whatever reason. They were not able to leave their homes. They were not able to contact someone because of the COVID pandemic. And so they were not able to enroll in Medicare Part A or B, or D as in dog, during their enrollment periods. Initial enrollment period is going to be for individuals who are turning of 65 years old. The general enrollment period is going to be for individuals who would like to apply for, let's say, Medicare Part B as in boy. That enrollment period is from January to the end of March. Special enrollment periods are for people who are working and have insurance through their employers. So if for whatever reason you lost your employment because of COVID, or even beyond that, we may be able to see if you may be eligible to enroll in Medicare. And that's going to assist with enrollment because the fact that you lost your insurance due to the pandemic, so you may be able to apply for Medicare as of now, even though you're outside of the enrollment period. I did see a chat here. Question, let me just see. All right, so JP Earthly sent a question. It says, if I have Medicare Part A as in apple and D as in dog, but my Lynparza is costing me $2,700 a month, can I purchase Part B insurance to cover my Lynparza? So Part B as in boy is only going to cover outpatient treatment. It's not going to cover prescription. So if you wanted to take a look to see if you're eligible to switch your Part D as in dog insurance, you can give us a call. Depending on the insurance that you have, you may be eligible to switch your Part D as in dog insurance so that it's covered under the formulary for Lynparza, so it's more affordable to you. You may be able to switch your plan now or later. So I would advise you to give us a call so we'd be able to take a look into your case to see what you may be eligible for. Okay, next slide. Okay, so Medicaid is another program that we assist highly with, and it's essentially for people who have a lower income, although it's not exclusive to that. So there's two ways you can apply for Medicaid. Traditionally, when you're eligible for Medicaid, you would go through the local district office, and that was for anyone who were under the age of 65 years old or older. But now, since the Obamacare era came into play, and that's a lot of patients who would refer to it as Obamacare or Affordable Care Act or New York State Exchange, anything like that, is going to be divided into two. So if you're under the age of 65 years old, you're not disabled, meaning you're not in receipt of Social Security disability or supplemental security income, you would go through the New York Health Exchange. So that is what was referred to as Obamacare. That is what was referred to as the Affordable Change Act. So as long as you're under 65 years old, you are not certified disabled or in receipt of Social Security disability, and you do not have Medicare, you would go through that program. It is only focusing on the income, not the resources. Resources meaning bank accounts or stocks, bonds, exchange, anything like that is not going to be considered when applying for insurance. So if you are Medicaid eligible, you would go through the New York Stock Exchange. And then we would refer you to the navigators who are working with our organization through the New York Community Service Office. They're available Monday, Thursday, and Fridays to help our patients with the exchange. So if you fit that category and your insurance, for whatever reason, is going to be terminated, we can refer you to our navigators. Next slide. So this is what I briefly mentioned. MAGI is going to be the modified adjusted gross income. So this is going to be for the health marketplace, New York State of Health, however you refer to it, Obamacare, Affordable Care Act. It is used interchangeably. So anyone who's under 65 years old, who is not disabled, who is a pregnant woman or children, parents, caretaker, income must be below a certain threshold, which is what we can basically look into, but there's no research test. We're going to assess the patient to see if they may be eligible for insurance through this program. So certainly give us a call so we can screen you if for whatever reason your insurance is terminated or there's been a difference in the income for the household. Next slide.
Thanks. And also, I know we're at 3. I'm hoping people are able to stay on since we got a late start. As I mentioned, I have seen all the slides and there's a lot of really, really important information coming up. So if you're able to, I highly recommend staying to the end.
Certainly. And if there's any information that any information that would anyone would like to follow up with, you can certainly send me an email, or in the future we can do another presentation. All right. So non-MAGI is going to be the opposite of what's considered for MAGI patients. So if you are over the age of 65 years old, if you're considered disabled, meaning you're collecting Social Security disability or you're in receipt of Medicare, if you're blind, if you require long-term care in terms of home care, if you are a former foster care youth, and the other categories below, then you're going to be considered a recipient of Medicaid through the local Department of Social Services. So the biggest difference is that with the MAGI population, they're able to apply for Medicaid and able to get a notice of decision the same day. And they're not considering resources. With non-MAGI, they're going to look at the household size. they're going to look at the income, and they're also going to look at the resources. So resources, again, include bank account information, stocks, bonds, IRAs, anything like that that pertains to the patient. They're going to look at that amount. So for a household size of 1, let's say, for example, the maximum income they're going to allow for free Medicaid is $845 for a household size of 1. For resources, it's going to be $14,850 for a household size of 1. This information will be changing for the year of 2021, so it's going to be an increase. But if you fit under that category, you're going to apply through the NonMami local department in social service. It does take 30 to 45 days on average to get a notice of decision for your application. With the COVID pandemic, they may be backed up, so it may take a little bit more time. But also, with the COVID pandemic, there's been a lot of easements. So in terms of supporting documentation, such as ID, proof of income, proof of resources, Medicaid is saying you can attest to that information. So you can provide us that information, and you don't have to provide proof that this is your income, proof that this is your amount with your bank account. So essentially, you're providing us with the information, as you know. We'll put it into the application, and you can go ahead and we can submit it. And the Human Resource Administration will be able to verify whether or not this is accurate based off of your employer, based off of your including Social Security income, as well as your resource. So this has been really helpful in terms of applying for insurance as of this period now. Next slide. So with the Medicaid program for the non-Magi community, there's 3 ways you can also have insurance. So if your income is a little bit higher than what Medicaid allows for a household size, you can still apply. You would have Medicaid, but you would have what's called either an excess income or surplus program. So this is going to be the difference between your income and what Medicaid allows for free Medicaid. When we do the deduction for the income, we would be able to get an approximate amount of how much you would owe for Medicaid in order to have active Medicaid every month. It's a little bit of a complex program, but with the COVID pandemic, if your income is a little bit higher than what Medicaid allows, they're still going to allow you active Medicaid every single month simply because of the COVID pandemic. With the Medicaid buy-in for working people with disability, it's going to be the same insurance for Medicaid that most people would accept. However, you have to be under 65 years of age. You have to be certified disabled, either receiving Social Security disability or a letter from your medical provider, and you have to be working. Working with the Human Resource Administration can be loosely translated. So it doesn't mean that you have to go to a 9-to-5. It could be you working for a neighbor, watching their pets for an hour at a time. It could be you watering their plants. It could be you walking a pet. Work is work. So if you are working for X amount of weeks for a neighbor, for a family under that category, then you would be essentially able to apply for the Medicaid buy-in working for people with disability. It allows you to have a higher income threshold compared to the normal Medicaid program, and as well as the resources. So that's something we can screen for. In terms of the Medicare Savings Program, we briefly mentioned that earlier. That's going to be for individuals who have Medicare and they would like assistance with the state to apply assistance with their Medicare Part B as an employee, which 2021 is $148 a month. And so the state may be able to assist you with paying that every single month so you're not responsible. Next slide. So these are the common calls we would have for Medicaid. We have a lot of Medicaid as inactive, and these are usually for people who have a surplus program in which they would need to pay an amount every month to activate the coverage. With the COVID pandemic, we have seen a lot of easements. So if a patient would like to activate their coverage, if they have a surplus amount, we could reach out to our medical providers and say, hey, someone needs their Medicaid active for an upcoming appointment, and the Medicaid office will activate it without expecting the consumer to pay that surplus amount because of the COVID pandemic. And so you will get up to 6 months of coverage, regardless if you pay your surplus amount or not, based on the fact of the COVID pandemic. Fail to recertify. So right now, again, because of the COVID pandemic, from March 2020 until February 2021, if you are due to renew your Medicaid application, you should automatically get 12 months of coverage based off the COVID pandemic. So if anything comes up where your insurance isn't activated for that reason, we can go ahead and reach out to Medicaid and say, hey, they fall under the policy that Medicaid said that, hey, if you're going to renew between March 2020 and February 2021, the consumers should basically have should essentially have extension on their Medicaid for 12 months. So certainly give us a call. The same can be said for the supplemental security income. When you are in receipt of SSI, you automatically get Medicaid. But there's been a number of patients that we have that when they are in receipt of SSI, for whatever reason, they no longer become eligible. If they're no longer eligible for SSI benefits, then technically their Medicaid should remain intact. But we have been seeing a number of patients who's calling us, letting us know that their Medicaid connected to their SSI is no longer active. So we can certainly look into that and advocate to someone higher up in Medicaid. We can also screen on immigration status. If you are undocumented, we can see if you're eligible for the emergency Medicaid. Emergency Medicaid, again, covers cancer treatment, kidney dialysis, and certain benefits. But if not, then we can look into the charity care that's offered through the hospital, which would be able to cover primary care, specialists, and other services. And then also, lastly, if the patient has a managed care plan through Medicaid that's not accepted by the provider that they would like to see, we can assist with switching over their plan. Next slide. All right, so this is what I pretty much covered previously. If a patient has a Medicaid surplus case, they're able to get 6 months of activated Medicaid coverage without having to pay their surplus every single month. And this is just due to the pandemic. With the individuals who have renewals due from March 2020 through February 2021, they're automatically given a 12-month extension, so they don't have to submit their renewals. Medicaid will send the renewals because it's automatically generated, but it does not have to be submitted. Medicaid is not perfect. So if someone's insurance is becoming inactive during that time period, we can always reach out and advocate for you guys to have your insurance reactivated and reinstated so that you're not concerned about that. There's also a waiver for supporting documents. Initially, prior to COVID, we would need proof of ID, proof of income, resources, etc. With Medicaid right now, they're only essentially asking you to attest to the information. So perhaps, your income, your resources is going to be information that you can only provide to us because you're not able to get the documents from your bank or your job. So they're going to accept that. The only exception is going to be for individuals who are a permanent resident. They will require your card front and back, but otherwise, income information as well as the resource can only be attested to, and we'll submit that to Medicaid, and that can help with the application process. So you're not able to go to the bank, go to your job to provide that information. They're going to accept your word at face value, essentially. Next slide. And so these are some of the programs that we've seen a lot of calls from patients. Rental assistance is going to be under the Public Assistance Program through the Human Resource Administration. If you are falling behind on rental arrears, you've owed several months in back rent, we can assist you with the application process so that the Human Resource Administration will be able to provide funding for back rent. These are all applications that we'll need to be assistance with and do a screening just to make sure that you're eligible for this program. So rental assistance will be for back rent or continuing rent assistance in the future if your income is lower than what your rent is. Cash assistance is another program that falls under the Public Assistance Program, in which you're able to get cash for whatever benefits that you would like to pay for. The SNAP program is going to be for food assistance. So a supplemental nutrition assistance program, depending on your household size and composition and the income, you may be able to get X amount of benefits per month just on food alone. So that can help with your monthly expenses. One-shot deal, that is going to be for individuals who owe back rent. And it can be, prior to COVID as well. Depending on the program, the individual may be responsible for either paying back in the future, or there's going to be grants in which they will not be able to, they're not expected to pay the monthly amount for the rental arrears they do owe. Home energy assistance program is largely for people who owe money for utility bills. Con Edison is one of the major ones that we see with our patients. So if a patient would like assistance in the future or prior, if they have any arrears, they would be able to assist with that. Next slide. So we're going to focus on two COVID-related resources that is still accepting applications for patients to apply, one of which is the Family Resilience Fund. It's for individuals who lost a family member who passed away due to COVID, and they're the breadwinner or the caregiver. So the eligibility criteria that you see below would be a referral source from the social workers, which is something we can do at our department. death from COVID-19, again, from a breadwinner or caretaker, at least one child who is under the age of 26 years old, and the families they're experiencing financial stress. And in terms of where they're located, you see here it's Bronx, Lower Hudson Valley, Queens, Brooklyn, Staten Island, and Manhattan. When in doubt, you can certainly reach out to us to make sure that a family member may or may not be eligible for this type of insurance with the pen. Next slide. Another program that we're seeing, and it's going to be the rent relief program. We're consistently getting updates from the states and other programs in terms of rental subsidies. The program is completely overwhelmed. So we'll have sometimes programs open and the application is completely closed by the end of the week. But as of now, they're accepting applications through the end of February in terms of people who owe rent. So they do offer a one-time subsidy for individuals who owe rent. The criteria is below. So must be a renter and have a primary residence in New York State. Must have low income between the period of April 1st to July 31st. And before March 7th, household income must have been or below 80% of income. And they must be rent burdened during the months they are applying for assistance between April 1st to July 31st. So a lot of these programs are pretty strict in terms of what you may be eligible for. It's always evolving. So even if you don't meet this criteria, you can always call us to see if another program have essentially come up with the new resources and application for something that you wouldn't normally be eligible for. So we can always screen you for that. Next slide. And so these are the resources. If we're not able to assist with it directly, we'll always refer to an outside source. So with the unemployment benefit pandemic unemployment assistance, traditionally when someone loses their employment, they'll apply for the unemployment benefits. And so if they're having difficulty getting their payments, it's been a while since they applied to pandemic employment assistance, then we'll refer out to an organization who may be able to do a lot of advocacy work in terms of getting that benefit. With the pandemic unemployment assistance, that's specifically due to COVID, with Medicaid or Medicare, there's been a lot of easements, so they may not consider that income in order to be eligible for those programs. So there's going to be a difference between the unemployment benefits the unemployment traditional pandemic efforts and the pandemic unemployment assistance. So we will be able to look into your case to see if, Medicaid or Medicare will consider that as income, depending if you're under the unemployment or the pandemic unemployment assistance. With the economic impacts payment, usually referred to as the stimulus payment, we're not able to directly look into your case because it is a federal program, but we're able to provide information regarding the status that you can check with the IRS. There's also a number of legal teams that we've worked with. If you haven't even received the first payment and you're still waiting for the second payment, we can refer you to that office so that they'll be able to look into your case. The COVID-19 emergency food distribution. Since the pandemic started, the city has been able to provide meals to individuals who are having a hardship with either going to a food pantry or getting food in their homes. So from what I've heard from patients, it's like sandwiches and some fruits and snacks that is being delivered to their home. So if you would like us to assist you with the emergency food distribution, that's something we can do. For the isolation hotel program, these are for individuals who have been diagnosed with the COVID pandemic and they're not able to stay in the same home with their family. And so the city is paying for individuals who cannot stay in their home because of their diagnosis into a hotel. And you can be able to stay in the hotel for up to 14 days so that you can quarantine yourself from your family. And it's a free service, and that's something we can also assist with. With the burial assistance, this has been around for some time, but because of the COVID pandemic, it's increased in terms of their assistance. So the city will be able to pay up to an X amount of assistance for burial funds that's made for a patient who passed away due to COVID. So if the individual has a certain household size composition, income, and resources, we can look into see if these people will be eligible for the burial assistance fund. They'll be reimbursed. They'll be reimbursed for some of the funds that they use for the funeral for the patient. And then lastly, with the Immigrant Emergency Relief Program, this is something that recently came out. We'll be able to see if a family who's considered undocumented and may not be eligible for the stimulus payments, we can always see if they may be eligible for relief through the city. And we don't know as of yet what that income will look like, if it's a one-time subsidy, but we can always see if the patient may be eligible to apply for these types of relief programs. Next slide. So this is some of the information that was shared with Rachel as well regarding test locations and vaccinations that's available in New York City for people who are either seeking to get the COVID-19 test results or who is also seeking to get vaccination. And I believe Rachel's going to CC you guys with the information to see who would be eligible for the vaccination. Next slide. Okay. And so the REAP referral line is what you would want to contact in terms of assistance with any of the benefits we mentioned before. Also, just in general, again, when in doubt, just give us a call. We may or may not have the information outside of what I mentioned, but we're always going to see if there's particularly a program that may be able to assist with the information that you're requesting. The main REAP number are for people who are already known to our program, and the REAP referral line is for new patients. So again, if there's any questions, even if it's something that may not be related to us, you can give us a call and we'll take a look to see if that's something we may be able to refer or any other questions. Okay, so if there's any questions, okay, I have a message here from JB Ursley. Okay, so I'm going to mention my email here. Any questions, guys? I know I threw a lot of information at you guys, but you know, if anything comes up, just let me know. I'm sending you my email information right now, JP.
Thank you.
Really, this was really amazing. And as I said to everyone, it was so chock full of information for anyone. I mean, you know, I've been a social worker at Mount Sinai for 22 years, and there's information in there that I didn't know. And I always find it confusing in terms of Medicare versus Medicaid, you know, versus the different waivers and the different programs. It was really so unbelievably helpful. And I think, you know, one big takeaway that I see is that, you know, all of you, you know, should reevaluate and see what programs you might be eligible for, because they are not all income driven, you know, and you know, you really might be eligible for you know, various programs that are offered. And that self-referral line is great. That's a newer development. The referrals used to have to go through a professional, but you know, Susie is just one of the examples of the amazing REAP counselors and advocates that they have there. So I definitely would encourage any of you to reach out directly to the program and see what you might be eligible for. So.
Absolutely. If there's something that you don't believe we'll be able to assist with, we'll always try to see if there's resources available. So again, when in doubt, just give us a call and we'll see if this is something that we may be able to assist with.
And just to confirm, Susie, in terms of cancer patients, I know you said, so cancer patients by nature of their diagnosis are not eligible for disability or anything like that. But it sounds like perhaps they might be eligible for certain benefits if they are not able to work because of side effects from their treatment, if that's kind of what I understood.
Right. So with the COVID pandemic, there's been a lot of easements in terms of what people are eligible for. Even if someone is collecting the pandemic assistance program income, that would be excluded from certain benefits that they may be eligible for. So we can always look into SNAP, Medicaid, cash assistance. This is something that may be able to assist them, you know, with their monthly expenses. So there is a lot of easements specifically now because of the pandemic. So I wouldn't want any patient to, you know, write themselves off from services that they may be eligible for.
Thank you so much for clarifying that. Thank you all for taking the time to join and, you know, hopefully to learn about some resources that might really be helpful to you. And for those of you, you know, we have a couple of volunteers on here for volunteers, you know, so, you know, for patients that you're working with, to encourage them to take advantage of these great resources that are available. Also, thank you all for your patience regarding our technical difficulties. Hopefully we were able to overcome it and still get you all the info. And we will certainly at the very least make the slides available to everyone, and we'll take a look and see what the status of the recording is in terms of being able to share it for those who couldn't attend. So thank you all again. Stay safe, and we hope this was helpful. And Susie, thank you so much for sharing your expertise and knowledge with us today.
Of course, and just let me know if there's any other categories you guys would like me to follow up with us.
That would be great.
Take care of yourself.
Thank you so much. Thanks, everyone.
Thank you too. Bye.
Thank you.
Thank you.
Thank you.
Bye.
Thank you. Thank you.
What I can do is, Susie, if you want to send me a follow-up email with the slides with your, you know, the contact information that you'd like me to share, we'll make sure to get that into the hands of everyone. And it also sounds like you can call that main REAP number, and then it sounds like either ask for Susie or one of her colleagues.
Okay, thank you.
Absolutely. For that information.
Thank you again so much. Okay, bye everybody.
Bye.
Thank you.
Bye,
Thank
everyone.
you.
Bye.